at the end of the day, New York is an innovative city and innovative state, but clearly I think much of the movement around the United States really, I think, got an incredible amount of energy from the work going on within New York City. And I think also the reality is that much of our movement really was started by disabled women. For many reasons. There wasn't money involved. People weren't getting paid for their work. Disabled people, as we know, frequently are doing volunteer work, and certainly within the disability rights movement, people like Bobby Lynn, who was involved in the formation of Disabled in Action, and then one of the founders of the Bronx Center for Independent Living, and Marilyn, who, as many of you know, wears many, many hats, and really I think Bobby and Marilyn epitomize one of the reasons why this conference is happening. And when we look at the title of the conference, Women Without Limits, or Disabled Women Without Limits, I think that's really what probably every one of you in this room stands for. Elizabeth, I found out yesterday when I was here, Elizabeth was a student of mine when I taught in Brooklyn, New York at PS 219. So the last time I saw her, she was much younger. And Esteban, who's not here today, also was one of my students, and he now works at ICS. So I'd like to know, how many of you were born with your disabilities? How many of you acquired your disabilities below the age of 10?
You all 10.
10 to 20. 20 to 40. And 40 up. Okay. So one thing about the disability movement is that we're not a homogeneous group. Not only do we not acquire our disabilities at the same point in our lives, which I think is a very critical issue, because people who were born with their disabilities or became disabled when they were younger, I think in many ways, and thinking specifically today about women, have had greater difficulty moving into society because of the prejudice and views of people towards us as disabled people. I think it's certainly very fair to say that the lives that Marilyn and Bobby and I, and those of you, I'm 63, the lives that we were born into whenever we acquired our disabilities are very different than they are today, because at that point in time, there were really no laws in place that gave protections to the rights of disabled people. People didn't think about rights for disabled people, and the whole concept of civil rights and human rights was also emerging. The African American movement was really playing a leadership role in moving a civil rights agenda forward. The women's movement was moving forward. The anti-war movement was going on. Other political movements for the elderly and others were advancing. But typically, we did not see the voices of disabled individuals within those movements. And I think that was one of the issues for many of us, because I think on the one hand, our families, as typically did not have other disabled people in them, so we were within our families and looking at what our families could be doing for us as we were growing up and beginning to look at what kinds of opportunities people were being told they could get in the United States. I mean, we all learned if you went to school, if you worked hard, if you did what you were supposed to do, you would have opportunities because you did the right things. But for those of us who had our disabilities when we were younger, the ability to get into school was a real challenge, because there was no law that said we had a right to go to school. So my experience in education was, one, my mother took me to school. The principal said I couldn't go to that school. They sent a teacher to my house twice a week for a total of 2.5 hours a week, and that was the expectation that was laid out for my family. Now, that was in Brooklyn, but that was not just going on in Brooklyn. We had no laws in the United States that guaranteed disabled children the right to an education. We had laws at that time which allowed a merchant to put a disabled person out of a restaurant if we were unseemly, if we were, quote unquote, ugly, or disgusting. And those were words in laws, like in New York State. So what we were really beginning to do as we were emerging was identifying friends and making friends with people who had disabilities. But that didn't come about easily either, because like I was in my house every day until I was like 9 years old. So I really hadn't met disabled people on a daily basis. And then we met each other in our segregated schools, our segregated camps, and our segregated social groups. And again, the model was not one of inclusion. The model was not a rights-bearing one. But what was happening at that time, as these other civil rights movements were advancing, was that as disabled people, we began to look and talk about what changes were being made in our communities that were helping people exercise their voices. So when you looked at other political movements, they were being led by people from those movements. The women's movement was not being led by men. The movement for people of color was not being led by there were people working together, but the leadership of those movements was coming from within the groups that were fighting for human rights and civil rights. But when you looked at the disability movement, we were not at that point really being led by disabled people. The message that was going on was very much one of charity. People were being asked to give money to cure disability, to prevent disability. People were not being asked to fight for the rights of disabled people, to fight for accessible transportation, to fight for accessible curb cuts, to fight for sign language interpreters, to fight for equal treatment in employment. That was not an issue. And certainly the issue of the rights of disabled women was also clearly not on the agenda, because what I was saying earlier is the other political movements really were not taking into consideration the rights of disabled women. They were in the beginning not taking into consideration the rights of other minority women either. But one of the beauties of the disability movement is that we are a very diverse movement. We come from every crosswalk of life and from every country. And our ability to come together and really forge great possibilities really lies within each one of us. And you know, for myself, growing up as a disabled girl and then woman in New York and then in different places in the United States, what was very clear to me also is that as a disabled woman, my sexuality was something that was not really discussed. Now, sexuality, as I was also growing up, was not necessarily discussed in families for disabled or non-disabled people. So I think, you know, we have to say that it wasn't just that as a disabled person I was the one being denied those kinds of discussions, because the whole issue of sexuality was really a new emerging issue for people to talk about. But we did live in communities where marriage was certainly something that people talked about for girls as you were growing up. There was an expectation that you were going to complete education, you were going to move forward, you'd get married, you'd have children. Now, that dynamic has changed. As we as women have said, we have a right to determine how we want to live our lives. But I think what's very important is if in fact you are not seen, I was not seen, others were not seen, as being able to be equal members of the community, there are very powerful messages that are being put there. The message from my family was, you need to study hard, maybe you'll get married, but that is certainly not the first thing you should think about. You have a disability, you need to look at being able to support yourself, because you're not going to be able to depend on other people to support you, and go off. And they weren't bad messages, but they certainly weren't the same messages that my non-disabled friends were getting. So one of the values of gatherings like this, but not gatherings like this once a year, but being able to take advantage of the different organizations that you are a part of as girls and young women and seniors, is to really look for opportunities to talk about who you are as women, what it is that you are trying to achieve as women, to be able to help each other network as women, to be able to look at how we can advance our lives. My presumption is that people in this room are knowledgeable, experienced people who are doing many different things in your communities. You're here to gather information, to give information, but you're really leaders. You're leaders in your own right. You help empower yourselves. You help reach out to empower other people. And empowerment is really what this is all about. Our ability to feel strong about who we are, to feel as individual women, we have something that we can contribute, and that we also have the right to demand opportunities to participate in all aspects of life. Certainly our sexuality, our ability to access quality health care across the board is critical. And what does that really mean? It means different things for different women, whether we have a disability or not. But it seriously means that we as disabled people have to be able to receive the information that we need in a way that we can understand it, to help us become empowered, to make sure that we are getting what good health care should be providing for us. It means in many ways that we either have to be advocates for ourselves all the time, but it also means that we have to help other people learn to become advocates, and in many cases it means that we have to join hands with people and look at whether or not a person may want us to go to a doctor for a healthcare visit, to be able to talk to people in advance. So you're going to a doctor, you're going to be having a pap test, you're going to have a mammogram, you're going to have whatever it is. What kinds of questions should you be thinking about? Are there other women that you know who have similar disabilities to yourself, who have had these kinds of exams? What has worked? What has not worked? What have you found that are have you found some good health care providers within your communities that are particularly responsible and responsive to the kinds of needs that you have? These, I think, are some of the very important things that we need to be looking at as individuals and as responsible women in our communities, help ensure that disabled women's risk for certain types of medically related conditions are avoided. Women who are not getting pap tests, who are not getting mammograms, women who don't understand the importance of talking to their families about their healthcare histories, because that's very important. What is the healthcare history in your family? What questions do you need to ask your mother, your grandmother? What kinds of issues have nothing to do with the disability that you may have now, but in fact may be coming up later? Those are all things that you learn over time. And in many cases, I think what we've seen is that people have not seen the importance of disabled young women and women being given access to the same types of information. Are disabled girls, in fact, receiving the same kinds of information that they need to have in order to avoid getting into high-risk conditions? When I was an assistant secretary in the Department of Education. I worked in the Clinton administration, Clinton 1. And we did a study, it was a longitudinal study looking at issues affecting disabled children and youth who were beneficiaries of educational services for kids with disabilities. And one of the questions that was asked in that survey was relating to pregnancy. And what that data showed us is that disabled single girls at the age of 18 were twice as likely to be single mothers as non-disabled girls. That is a huge issue. That means typically that individuals with all types of disabilities, but in many cases also including young women with learning disabilities, mental health disabilities, intellectual disabilities, are probably not receiving appropriate information, But the bigger troubling issue is what we know is the violence against disabled young girls and women. And violence against people in general is obviously not acceptable and something that the women's movement and other movements have been fighting against. But to ensure that disabled girls and women are not experiencing violence, or when that violence is being experienced, that they have to be able to have the same right to services as other people, is still something that is not happening commonplace. Because people do not view us as sexual beings. And therefore, they don't believe if we are not a sexual being, they don't believe that we are necessarily at risk or at higher risk. But if you look at, for example, the Department of Justice, the Hate Crimes Act that came out 2 years ago includes disability. So there is now data being collected on hate crimes against disabled individuals. And when you look at the data on hate crimes against disabled individuals, you will see that hate crimes against disabled individuals in the area of rape and assault is much higher percentage-wise than against non-disabled individuals. Those are all very important pieces of information. When I worked at the Berkeley Center for Independent Living, we began to have women who were coming into the organization for services who would call or come in and talk about the fact that they were living in situations that were not safe, that they were being abused by one person or another. And we felt that the level of abuse was such that we wanted to make them aware of women's shelters where they could go and get appropriate services. What we found out at that point was that the women's shelters would reject disabled individuals in many cases. They weren't physically accessible. They didn't feel that they could serve people who were blind or deaf. They didn't feel they could serve people who had intellectual disabilities. And we worked with the state of California, and we got a grant for the Bay Area, and we worked with the shelters to help them do assessments around accessibility, both physical accessibility, as well as doing training of their staffs. This was done by disabled women, and we were able to make a change in the shelters that existed in that community. Now, this is something that is slowly happening more and more. I think the whole issue of shelters for abused women, more shelters are becoming accessible. In some communities, we've seen separate shelters being set up for deaf women. But I was at a conference in Canada a couple of months ago, and a woman came up to me and said that one of the big issues in Canada with the shelters is the fact that many of the shelters are not knowledgeable about issues affecting disabled women and how this is an issue that they are focusing more on. And it is becoming an issue which is being looked at the international level as organizations addressing issues for people in shelters is being discussed. Issues of HIV/AIDS, another very big issue. Disabled individuals being at risk of contracting the virus, of women and men not knowing what is safe sex. When I worked at the World Bank, we did a study that was involved with the office at the World Bank on HIV/AIDS, because there was no international data looking at the issue of HIV/AIDS and disability. And what that study showed, and the following work that's going on, is the woman who authored the study said that she believes that the rate may be twice as high for disabled individuals in continents like Africa. But in the US, we're really not collecting data on this either. And when I see what's going on internationally in the area of HIV/AIDS and disability, I see much more going on than what I see going on in the United States. But when you look at the issue of violence against disabled individuals, and when you look at some of the cultural beliefs that people have, that disabled individuals are not sexual. If you have sex with someone who's a virgin, it can help you get rid of your infection if you are infected. All these types of things have very big ramifications for those of us who have disabilities. So I want to give you a little information about some of the other work going on internationally, because I think it's very valuable for work that we're doing here in the United States. New York City is a home for people who come from all around the world, people who come to the United States for whatever the reason may be. We're in a unique situation where we need to be speaking to people who have disabilities, who themselves or family members have come from other countries, to get a better understanding of how people have been treated in the countries that they've come from. Because I think when we look at people who are coming to the United States, who come from different backgrounds, there are even lower expectations for what people should be expecting. Because in many countries, the rights of disabled people are really emerging. And the ability to, is anybody going to make it a little warmer in here? Everybody's putting their coats on. Huh? Yeah, lots of people are putting their coats on. But we have a unique opportunity in New York City and other major cities around the United States to take advantage of our communities, to learn from the people within our communities, not only to improve the quality of health care and general living conditions, ability to go to school and get jobs, etc., but in focusing on the subject that we're looking at today, in really learning more about the mores of countries, in really learning more about how to make sure that the healthcare services which are being provided are culturally appropriate as well as disability appropriate. Because if services are not culturally appropriate, in many cases people will not go to receive services. So we have many different issues we need to be looking at. There is something called the Convention on the Rights of Persons with Disabilities. Has anybody heard about this? 3 people. 4 people. Okay. 5. In 2000, well, starting in the earlier 2000s, an entity called the United Nations. How many of you have heard of the United Nations? Good. Good. The United Nations is a very important body, I think both for the United States but internationally. It's a body of countries from around the world, 192 countries, that come together on a regular basis to address many complex issues. One of the parts of the work that the UN does is it develops something called treaties. You could think about it similarly to the Americans with Disabilities Act. How many of you have heard of the Americans with Disabilities Act? Good. Not everybody has. Are there any people who can honestly, without feeling badly, have not heard of the Americans with Disabilities Act? Okay, everybody knows that. That's great. The Americans with Disabilities Act was a very important piece of legislation. Why? Because the disability community from around the United States worked for about 8 years as a cross-disability movement, basically saying to the federal government, the degree of discrimination that exists against us as disabled people is such that the federal government must intervene. That the failure of the federal government to intervene is resulting in millions of disabled people not only being discriminated against on a daily basis, but having no recourse, no ability to address a violation. So one thing that the Americans with Disabilities Act did was very broadly define the types of discrimination, and then it identified federal agencies that have responsibility if we believe that we as individuals have been discriminated against, where we can file a complaint, where the Justice Department or the Education Department or the Labor Department can come in and investigate a complaint, can investigate a complaint about lack of accessibility of a hospital, can investigate a complaint about poor quality services that you as a disabled woman or man are receiving when you go for services, because they can't lift you onto a table or because they don't listen to what you have to say. Whatever the issue may be, we now have a federal law And in states like New York and others, there are also additional pieces of legislation. In many countries around the world, there have not been equivalent laws. And so the disability community from around the world had been working for many years at trying to say to the United Nations, just as we were saying to the federal government here, there is a need to create, in this case, a treaty which would ultimately be signed by the United Nations General Assembly, and then would go to every state, every country, or member state as they're called. So there is something called the Convention on the Rights of Persons with Disabilities. You can look it up on the website, and Marilyn and the organizers of the conference, if there's follow-up, maybe you can also send people the link to this. It's a really valuable document to look at. It's not very complicated, but it basically talks about the rights that disabled people should have. It cannot make a government adopt it, but it talks about, for example, recognizing that women and girls with disabilities are often at greater risk, both within and outside the home, of violence, injury or abuse, neglect or negligent treatment, maltreatment or exploitation. That's a part of the preamble, the beginning introduction of the treaty. So how did something like this get into the preamble? It got into the preamble because for about 4 years, disabled people from around the world, including many women, came to New York 2 to 3 times a year for 2 to 3 weeks at a time and met with representatives from governments to talk about the kinds of discrimination that disabled people were facing in their countries. In Nigeria, in Vietnam, in Pakistan, in Colombia, in El Salvador, in Canada, in the US, in Japan, in Vietnam. And these discussions really were focusing on, just like we did with the Americans with Disabilities Act, giving legitimacy to the fact that while the United Nations cannot make a government do anything, it was going to lay out the principles of what countries should be looking to achieve. So there are many different articles. One of the articles is on awareness raising. It says states parties undertake to adopt immediate, effective, and appropriate measures to raise awareness throughout society. So if you think about the conference today, in looking at raising awareness throughout society, what does that mean? That could mean that disabled young women, family members need to be in the media. We need to be a part of the healthcare discussions that are going on within the women's movement. We need to allow people to get a much better understanding of the positive things that have been moving forward, in the changes that have been being made to improve healthcare for disabled individuals, but also to talk about the barriers that still exist. We need to be talking about how, when we address issues affecting women in healthcare, how the voices of disabled young women and women need to be a part of those discussions. We need to be at the same tables when the city of New York or the state of New York or the federal government in Health and Human Services are addressing issues around health. Are the issues affecting disabled girls and women being included in the discussions and the work that's going on in the area of health care for women? And we know the answer is not the way it needs to be yet, but it is something that we have to be working on. One of the other issues it raises is that state parties should be working to combat stereotypes. And some of the stereotypes that I was raising earlier: disabled people are not sexual. Disabled people, therefore, don't need to have the same kinds of medical interventions as other women. We know these are stereotypes. Disabled people can't work. disabled people, whatever the can't be. We need to be raising awareness to allow people to see that our disability is a normal part of our lives. And we, whatever our disability is, continue to want to be a meaningful part of society. So raising awareness is helping people to get a better understanding of who the leaders are in our community. What are our issues? Holding people responsible to that. There's a whole article on health. And that article on health speaks, I'll give you a couple of the examples in the article. States parties should provide persons with disabilities with the same range, quality standard of free or affordable health care and programs as provided to other persons, including in the area of sexual and reproductive health and population-based personal health care programs. That is very powerful. I think what's very powerful about this is an international document. This shows that disabled people from around the world are facing some of the exact same problems. The United States has not yet ratified the convention. It's one of the areas that I'm working on within the State Department and 17 other federal agencies and civil society organizations or nonprofit organizations like the groups that are organizing the conference today. It is going to be important. We've signed it. President Obama committed to ratifying the convention, but the ratification will happen after 67 senators vote for it. The package will be going up to the Senate in the next couple of months. But the reason why I wanted to discuss this is because it will be important for you to look at this and to think about whether or not you want to let your two senators know that you support ratification by the United States. The United States ratifying this convention is very important. It's not as important specifically for changing laws in the US because basically the review of this package compared to US laws basically says we are in compliance. You know, we have what is required by the convention at pretty much the highest standard. Not meaning that there's not a lot more that needs to be done on enforcement in many other areas, but meaning if you compare ourselves to many other countries, we have, as a movement, been working for 30, 40, 50 years, and those benefits have really been paying off. But it will enable us to be a more equal partner at the table. It will enable us to work with other organizations like those of you here and say, you know, we are working with you. And when looking at the role that the U.S. government plays overseas, the U.S. government does give money to countries to help them advance their democracies, to help them deal with issues of road construction, healthcare centers, education, etc. One of my jobs is to really work on getting disability integrated into that agenda. But our ability to get this convention ratified will be very important for us, and there are 99 countries now that have ratified the convention, so we need to be a player at the table. Let me get back so that we can have a couple of minutes for some discussion. But you represent hundreds of people. Maybe in New York City you represent thousands of people. I want to leave you with the message that you have an incredible wealth of personal information. You have an incredible wealth of information in the work that you do, whether it's paid or voluntary, on a day-to-day basis. You care about this issue personally and for others, or you wouldn't be here today. And in thinking about the convention and the issue around raising awareness, as disabled women, we need to continue to speak out. about what we are being denied. We need to also speak out about the beautiful women that we are and the major contributions that we are making in our communities. We need to be recognized for our uniqueness and the contributions that we make and the contributions that we will continue to make. There's a woman in the audience, Monica, where are you? So Monica now lives in Brooklyn. I don't know how many of you know her, but Monica, you came from Jamaica? Yeah. So Monica moved from Jamaica recently, but Monica also was very involved with an organization called Disabled Peoples International, which is another important organization that was started in 1980 by disabled individuals with different types of disabilities from around the world. Monica has a wealth of information, not just about, she has a statistical background, she's very knowledgeable and has great expertise, both from a professional perspective, but also having done an incredible amount of work with disabled individuals in Jamaica and around the world with the work that she did through DPI. There are many other people who have this level of expertise. We need to take our opportunities to share this information, to benefit from this information, and to let it grow. There are two, I started going around asking people, who are you, why are you here? And I met Ginger and Jen. Ginger and Jen are from the Shepherd Center, which is a rehabilitation center in Atlanta, Georgia, where there's a great guy that many of you know named Mark Johnson, who's with an organization called ADAPT. But they came here specifically to see the work that's going on here, because they're interested in replicating some of the work that's happening here. So you can see the influence that you are having. And I just want to say that I'm really very proud of the work that all of you are doing and all the organizations that have put this together. And I completely agree that there should be a way to have a conference like this in a major hotel where you could be doing more outreach to bring more women in and really have continued discussions as you're having today, to subsequently show and allow people to hear about the voices of disabled women and to become a more meaningful part of the overall reforms that are continuing to go on in the United States in the civil and human rights area for women, including disabled women. Thank you.